Those of you that had English teachers in high school that were into English lit, A Modest Proposal by Jonathan Swift was about eating kids, but in this case, it's about changing the American healthcare system. I have the great pleasure to introduce to you David Gallegos, a friend, full disclosure, also, was a consultant of my companies for a time. David basically began his career in healthcare tech, I guess would be a fair way to say it, becoming the chief information officer at Fallon Health and then Vista Health Plans. From there, he went into consulting, and that's where I got to know him at HTMS. They were like the perfect consultant. When I was, one of the co-founders of one of the ACA health plans in the great state of Utah, and we used to get requests from CMS that, hey, you're going to do X, you're going to do Y, and I'd call his firm up and say, hey, you guys have any clue here? Like when they were inventing the Edge server, nobody really even knew what that was, or much less spell it. And it was his firm that actually, I remember going to my CEO saying, hey, I need you to authorize $75,000 right now, and I really can't tell you why, but I can just tell you that we need to do it. And that was a real interesting conversation. But without further ado, I want to introduce David, who has been in the system for a long time, has seen all of its failings, success as well, to really talk about where we should start thinking visionary-wise of where to take our system. So with that, I'm going to shut up, and David, thanks again for joining us.
Thanks, Sean. And I really appreciate this being a conversation. I did put together some slides that I'll walk you through, but I really appreciate your feedback and your comments. As Sean mentioned, I've been in the industry for 30 years, and what I've really come to is I've just gotten tired of us trying to tweak the edges of our healthcare system. When I first got involved in healthcare in 1992, we were talking about primary care integration with behavioral health. And of course, we're still talking about that. So one of my passions is to really advocate for changing the way we deliver care. And I don't mean tweaking around the edges anymore. I mean big change. When I look at the U.S. healthcare system, I would say it's really not broken. Because I don't even really think we have a system. It's really just poorly designed. I mean, our system was a foundation. As a foundation, which just happened by accident, and then was layered on top of it with a patchwork of quote unquote fixes. But we've never taken the time to really think about, if we were going to redesign our healthcare system from scratch, what would it look like? So this presentation is based on an article that I'm going to be publishing. Excuse me. And what that article aims to do is that developing a system by design is actually possible. And it can be done using our existing private insurance companies, hospitals, physician groups. And so I want to share with you one idea. I'm sure there's lots of different ideas. But again, I welcome your feedback both on the presentation, but also on the article when it gets released. So these things are almost cliche at this point. I mean, everyone knows that the United States spends more than every other developed nation. We spend almost, actually by the latest numbers, I think we spend more than $15,000 per person, which is double what most other countries of our maturity spend. At the same time, we're 30th in terms of life expectancy. We're 32nd in infant mortality. We have the highest level of avoidable deaths. The money that we spend in our healthcare ecosystem is not providing the value that we have. And what I tell people, as I mentioned before, is we don't have a healthcare system. What we have is a healthcare industrial complex that really was built over the decades by accident and by these different patches that were put on. And so the outcomes that we get should be expected. They are the results of the processes that we have built over the years. And when you take a look at all the different players in the market, you can't really blame any one of them. You can't blame the doctors. You can't blame the hospitals. You can't blame the insurance companies, because they're all doing their job based on the way the industrial complex has been organized. And so what we really need to do is, instead of trying to blame everybody about why healthcare isn't working for Americans, we really need to just redesign the way healthcare is delivered in our country. So again, some of these things already, but this system that we have, quote unquote, has really been designed by accident. It happened starting in the early part of the 20th century, with different models that were being developed for employers and unions. And then, of course, you had the wage controls that came about during World War II. And then we layered other things on top of it, like Medicare, Medicaid, the ACA, et cetera. And through all that process, we did not think of it holistically. We were looking for political expediency and trying to solve specific issues without looking at the whole. And so that's what we have today. And what has ultimately resulted is a much more complicated, more fragmented, a system that is difficult to access, difficult to navigate, and of course, terribly expensive. So the idea that I have is one that basically replaces all the patchworks that we have today with one. And it is bold, and I'm sure it's controversial, but it would simplify the approach to how we deliver healthcare in our country, and it would replace it with what I would think is a much more system or thoughtful design for how healthcare is delivered. So there are 4 foundational principles associated with this idea. One is broad risk pooling. When you have all these different patchworks that basically carve up our population into literally thousands of different risk pools, you don't get the benefit of the 350 million Americans that exist in our country. The next one is around aligned incentives. Right now, and we've been talking about value-based healthcare for a long time, and it just never materializes because it really isn't. There is no incentive to innovate. When a hospital or a health system thinks about value-based healthcare, there's an opportunity cost, right? It's not just a cost associated with setting up that value-based healthcare, a contract arrangement. But what if it doesn't work out for them, right? They know the fee for volume works, and they make money that way. So trying to innovate really doesn't. There's no incentive to doing something different because they're making so much money with the status quo. The third one is we definitely have to leverage technology. In every other industry, whether it be in the cell phone industry where this is basically a mainframe in my pocket, to the cost of compute with AI, to even automobiles, the price have gone down drastically. When you leverage technology. But with our healthcare system, the exact opposite has happened. We have really not been able to leverage technology to reduce costs. And again, there's no incentive for it. So the things that could reduce costs, like remote patient monitoring or virtual visits, there's no incentive for it. So people are not really deploying those options. And then lastly, we need to drive real competition and real choice. Right now, who is the consumer of the healthcare, right? It's not the individual that chooses their health plan for the most part. It's the employer, it's the state, it's the federal government. So the individual patient does not really have true choice. So with those four principles, I've come up with a model that is driven off of 2 different pillars, and I'm probably explaining it more in a more complicated way than it has to be, because it really comes down to 2 different ideas. One is, first and foremost, one system, a single federal framework that basically provides universal access to all Americans and legal residents that, just like Medicare and Medicaid cover, after certain thresholds. And then that federal framework is then distributed and delegated to states to administer. The second pillar is a model of really innovative care model redesign. So how do health systems, now that they're given the opportunity to compete with individual patients and members who are competing for that product, because the states, everyone would be able to choose from their own insurance company, like they do with the ACA, or they do like employers do when they go out to market. So once you have a model where consumers are now choosing their carrier for how they're going to get care delivered, then innovation can really happen at the delivery of care model locations. And so those are the two main pillars of this plan. So under this model, every U.S. citizen would have access to a standard plan that would be purchased on in the market. They would also have the opportunity to buy up if they so choose. Maybe they wanted a broader network. Maybe they wanted to, there could be a whole bunch of innovation that happens around the actual product area, above and beyond the quote unquote standard plan. The contributions toward this plan would be progressive. So people who could not afford the standard plan, there would be mechanisms to enable that. People who obviously can afford to pay more would pay more. Employers would no longer be responsible for health benefits. And I know a lot of organizations, gas stations, they have 50 or more employees, they should be focused on, pumping gas and taking care of cars, not dealing with healthcare. And
David, if you took a poll, I think 100 out of 100 would like to get out of the health
exactly.
business.
They need to focus on their business, not on delivering healthcare. And especially because it's terribly expensive, but it's also complicated. Health plans, hospitals, clinics, and physician groups, they would all remain private. And so they would compete within a standard regulatory environment. Care then would be incentivized to be integrated because incentives would be more aligned. There'd be opportunities for physicians and other caregivers to be thinking about, how do I deliver care more efficiently so that I'm able to be focused on preventative care instead of sick care. Every insured would be a true customer because they're the ones who are actually buying and choosing their insurance plan, not their employer, not the state, not the federal government. No citizen would face bankruptcy due to healthcare costs, which is crazy. We're the only country in the world that faces such a threat. And what doesn't change, which is the most important thing, is we really keep our private institutions. And this is something I think is really important because I do believe in capitalism. I do believe that innovation, when capitalism is done right, will drive all sorts of value like it has in every other market, which right now the healthcare system is not really a true market. So how do we get there? First of all, this is just the start of a conversation. The idea here is to come up with an idea, and one that I think is feasible, that I think actually would be least disruptive than many of the other ideas that have been floated. I do think the status quo is unsustainable. Now, we've been saying that since the 1960s when it was only 12% of our GDP. But, we're talking about a $5.3 trillion industry that's headed to be $8 trillion. $8 trillion? So, to Sean's point about employers, I think if you polled 350 million Americans, most of them would say our healthcare system is not working for them. And so I think the people are fed up. I think physicians and other caregivers are fed up. I think employers are fed up. I think everyone wants change. I think something like what I'm proposing is worth considering. Now, it's not going to be easy. There's tons of vested interest in this whole thing, right? Again, $5.3 trillion is a lot of money. Even if you were to cut just 10% of that, Who's raising their hand and saying, cut my portion of that? One man's waste is another man's profit. And that by some estimation, our current system as it exists right now, about a quarter of it, let's say 20% to be cautious, is all associated with administrative non-value added stuff or waste. I mean, things that are not going to direct delivery of healthcare. And so, this industry can afford a lot of lobbyists, and nobody wants their cheese to be moved. And so we're going to have to really advocate for change. And I'm a big believer, when the people lead, the leaders will follow. And so we need to talk to our politicians. We need to be coming up with ideas like this. We need to be advocating for change. And that is really the only way it's going to happen, because the vested interests will scare people. They'll say this is socialized medicine, and this definitely is not socialized medicine. They'll say it's government takeover of healthcare, which, again, the way I've tried to outline it, it's definitely not. I'm a big believer in limited government. So this is probably the biggest obstacle is people are getting rich off our current system, and they're getting rich off the waste that exists and the waste and inefficiencies of our current system, and they're going to push back hard against any change. So, questions, comments? I mean, I have an article that comes out that's going to be a lot more detail. I didn't want to take up your whole meeting. I could talk about this for 12 hours, but that's a high-level overview of what it would look like.
Any thoughts on this? Like I said, it's bold, and I kind of jokingly called it the modest proposal. Some may call it the impossible dream, but here's the reality. If at some point the industry doesn't fix it, the government will, and that's where you'll get single payer, which would be the worst of all scenarios. But I can tell you right now, we are on that path if we as an industry don't figure it out. And we're mostly on the front end marketing side. Gee, how does this affect us? Well, it affects us because I think what you see going on behind the scenes in ACA and Medicare right now is because of this, and a lot of us are getting affected on the commission side and other elements such as that. But thoughts or ideas to throw out?
Hey, David, that's fascinating. It's awesome. Thank you so much. I can talk about this topic for days. I see the issue that you just masterfully laid out. Is similar to when we wanted to go from the gas engines to electric cars. So that was exactly the same thing. The oil companies and the energy institutions and companies, organizations, they were pushing back. And I do remember living in San Francisco, that Bay Area, Silicon Valley. There were companies and there were thought leaders coming in, pitching the electric cars that, hey, we can do that, technology can fix it, and all the above. And for years, that was push-pull. It was a little bit obviously different, the impact compared to healthcare, but finally it happened. And based on my studies in the small-scale societies and the evolutionary the past in the healthcare systems in human societies, this is also happened when the mating systems and families, they started to transition from the big families and that they could dominate the mating system. So whomever wanted to get married, if you were a bigger family, a wealthier family, you had access to everything. You had access to, if you were a man wanted to get married, you had access to all the high quality females and families, and the other way around. If you were a female, you had access to stronger men and all of those. But
like dowry.
Yeah,
like dowry,
like dowry, exactly, like dowries. And then at one point, eventually the system started to talk about the equality, that hey, okay, so if you are a man or if you are a woman, you can just have one wife or you have one husband, and this is how the system works. And it came in, it required a little bit of regulations, but now we are in most part of Western world, we are practicing that, and this is not even a question. It happened a long time ago. So I'm with you on that. We are politicizing the healthcare. So in other countries, based on my research and understanding, the healthcare is the red line. So politicians, they don't talk about healthcare. Healthcare is given, regardless of how much you pay or you don't pay. It is given. You talk about the foreign policies, you talk about some other resources, some different values, but healthcare is the red line. If you are a politician, you are not talking about healthcare. Healthcare should be there. So fascinating stuff. Just wanted to give you feedback.
Well, first of all, I appreciate your feedback. And so a couple things just to just add on to what you said. One is that everything's impossible until it's not, right? I mean, no one thought I could have a mainframe in my pocket, right? And it's there are just so many examples of where people thought it was impossible to achieve something, and yet we have. Okay, the American people in particular are really resourceful, and they will ultimately do the right thing when all other things have been exhausted, as the saying goes. But the good news is that we're not really treading on new water. I mean, other countries have had systems that developed by accident, just like we did, but then came to the conclusion that they needed to design something that fit their people, right? And so you have lots of different models across the globe that are unique for them. And you look at some of them. You have national systems like they have in England. You have a kind of a federated system, but very government heavy in Canada. But you also have private systems in Germany and Switzerland, the Netherlands, and Singapore, which are closer to this type of model, where it's mandated insurance, but it's all run by private entities. So, I'm not suggesting that we copy any of those models. I think we should learn from them. But I think we need something that's uniquely American, and I think if we put our heads together, with the smart people on this call, but also, a whole bunch of other people, if we really put our heads together, we can come up with a model that is just simpler. I mean, why is it so complicated? It doesn't need to be so complicated. There's a whole business called payment integrity. I mean, it's billions of dollars. And all they're doing is, on one side, they're providing analytics to the health plans to figure out how not to pay a provider. And on the other side, they're providing analytics to providers that are just trying to figure out how to get the most money out of health plans. And that's adding no value to anybody. I mean, how about if we just simplify it? So when a claim is submitted, it gets paid and there's nothing to it, right? I mean, they do it, frankly, in the PBM world. You go into the pharmacy, it's real-time adjudication, right? I mean, the stuff is that we have the technology to do it. We just need to have the will. And that's the biggest problem I think we have is, we have, one, the big vested interest who really have no interest in changing anything because they're getting fat and rich off of the current model. And then we have just the will. To your point, nobody wants to talk about it. It's a red line, or the third whale, as we said in Boston. It's a political, lightning rod.
And David, the cultural aspect, the cultural change is also extremely important, because we do have in our society the taboo of healthcare information. So everyone has that taboo, and I don't know how the culture started. But we have learned that, hey, your healthcare information is sacred, and you have to keep it very, very, very close to you. And even your wife can't have it. even your children can have it. So unless you are a minor and there are parents taking care of you, that parents can have your health care information, nobody else does. So that taboo is we are guarding our healthcare data. That is causing a lot of costs, a lot of issues that we are just protecting that. And I know there are bad actors everywhere, and then if they have our bank account, they can just go in and do bad things. If they have our healthcare information, they can have a bad thing. But hey, what is the cost? What is the trade-off that we are guarding our the healthcare data? And at the Baker's Health Conference a couple of months ago in Chicago, they were talking about the healthcare data liberation. And that is something that it comes in from this current administration. And they are talking about this, that, hey, is really healthcare data with all the technologies that we have, is it that important that we are just sacrificing everything that you just mentioned? Maybe we have to be a little bit softer. So the data exchanges, they can exchange everything between payers and providers and everywhere. And then the consumers, they can have their data with them and they can share it with whomever they want. I can share it with my neighbor, like, small scale societies. You go down to South America, to the Amazonian, Ecuador, and everyone is talking about it. So neighbors, they talk about their health care, and then they talk about, you don't have to go to the shaman who has all the remedies and everything, but you can just talk to everyone. So these are fascinating stuff. And
yeah, we just need pragmatic solutions. I mean, you're mentioning is just one of many examples where we've layered on complexity that is not really necessary. We need practical solutions, and they don't need to be complicated.
You know what, though, when you bring up culture as well, we have this American culture as well, where we are mention the word universal health care and there'll be a knife fight in the middle of the building. You know what I mean? Because everything we do has to be like branded American. Like, look, I'm America's health first. You know what I mean? Like, it's actually ironic that I'm saying this, but I think we need to think, how do you get past that too? Because our system is definitely broken. Any way you slice it, it is socialized. I don't care what anybody says. When my state's paying for, like a good 25-30% of the marketplace, that's socialized. So I agree. There's got to be a better way. And as a connected society, we're connected as hell. There's no reason we shouldn't be able to do things like directly negotiate with hospitals and things of that nature, to bring down medical costs so that, it's not just the board of United Healthcare taking their $40-50 million bonuses, so that it does work for everybody.
Yeah. Any other questions for David? I know we're getting close to top of the hour. Just want to see if there's any final ones out there. Well, David, thank you. If you're okay, can I send your presentation around?
Yeah, please do. And I will have an article published, I think, by the end of the week is my intent. So, Sean, I will thank you for reviewing the first version of it. But the final version will come out later this week, and please share it widely. I really want to start the conversation, and I think we need to have pragmatic solutions. And frankly, we're already spending the money. We can afford a much better, purposely designed healthcare system for the money we're spending today. Clearly, I think
absolutely. I mean, hell, we do have the best Congress money can buy, so why not, right?
Well, thank you.
Best line ever.
Thank you, guys. Really appreciate it.
Thank you.